Hello, this is Leigh Johnson. I'm Director of the Johnson Group, Public Sector Recruiters. And here today, though, in the Lower Hutt, talking to Paul Abernethy, who's the General Manager of Programs and Practice Development.
I know.
Get that right?
It took me a while to say that too.
Yeah, and with the Te Awakairangi Health Network.
Correct, yeah.
Correct.
Yeah.
Now, you've not been here very long, Paul, so can you please tell us about why you joined this organisation?
Okay, I joined in October last year. I was looking for a new challenge, a new set of challenges in my career, ready to step up to another management post. I've been in health for a long time and was looking for an area that I could work in close to primary care, working in a community, obviously being able to make a difference in that community as well. I was interested in some extended cultural experience too, coming from the South Island. So I was keen to work with Māori and Pacific communities, and in this role we clearly get to do that.
Yes.
We're part of a network. Yeah. Also, I guess it was the sort of work. It was a mixture of projects and ongoing maintenance type work. And I guess I also recognise it's a great organisation with great people.
Great. And the area, you talked a little bit before about the Hutt Valley and what you enjoy about it. So
I did. People think I'm a bit crazy because of the big fanatic of the Hutt Valley. I think it's a lovely place. It's one of the best kept secrets in New Zealand, I reckon. With green trees, a lovely river flowing through it. I'm a fisherman, and so I've rediscovered the art of catching fish up here in the Wellington Harbour, or on the River Harbour, or indeed in the river, although I haven't caught too many in the river yet. Lots to do, lots to see. It's a place where housing is affordable, with good schools, good options, in particular Lower Hutt, Upper Hutt.
So a good option for families.
Yeah, good place to relocate to.
Yeah. Now within your team, where you've got some vacancies, and I understand some new vacancies for some project managers to join you. I wondered if you'd tell us about those positions and.
Sure. Yeah, happy to. Look, these are new roles because we've got some extended functions that we've taken up. We have a good, strong relationship with our DHB, a very positive one. We have a new alliance leadership structure that's been established in the Hutt Valley, as has been the case across New Zealand, and we have some projects coming out of that. So, number of projects. We've got an acute demand project, so we're really looking at the number of people that present to the emergency department and looking for other ways perhaps managing them closer to home. We've got some older persons' health projects, aging population,
increasing demand.
Long-term conditions. We're looking at the way in which Care Plus operates and looking to reshape and reform that slightly. And we've got some sort of child health and long-term condition related projects around that. So a variety of projects, and I think some interesting ones for people who have an interest in project work and making a difference for the community.
And who will they get to engage with, and what would they be doing sort of day to day around those projects?
So a number of these projects will be working across the primary, secondary sort of interface. We're increasingly looking at the health system as one system, so that distinction is sort of fading, I guess, but working with hospital clinicians, but primarily with general practice people and community agencies and community providers. So really working to motivate and mobilise GPs, practice nurses to pick up and take on these projects.
Right. And you've got quite a team here that they would work with?
We've got a strong team. We've got a number of other program facilitators and project managers, pharmacists, so we have quite a multidisciplinary approach. We've got a clinical director who's just recently joined us, providing that leadership. And so we have quite a diverse and quite a high power team, I think.
And why would someone want to come and join your team in this organisation and do this work?
Well, I think it's a little bit like why I joined. It's a good place, a good time, an organisation with a future and a direction. And we know where we're going. We have a good, clear lead from our board and our CEO. So we've got a mission. We're on a bit of a mission, but we know where we're going. And I think this is a place where you can make a difference. I think if you look around, it's a microcosm of New Zealand in many ways, and so lots of need, but lots of opportunity to meet that need too.
And what do you think this person, if it's these people in these roles have been here for 12 or 18 months, what do you think they'll be able to say they've actually done or contributed to?
Look, I think we'll measure that through the quality of their relationships too. Primarily, I think they'll have formed some good, strong partnerships with general practice colleagues, both practice nurses and GPs, they'll know a number of the community agencies that we work with. They'll have a good sense of the community issues, and they will have made some good progress and be able to measure that in terms of the targets that we measured by.
Yeah, sounds
So
very
they'll see that
exciting.
impact. Yeah,
Yeah, and that's very satisfying.
absolutely.
Yeah, so it's not just a job, it's a job where you can see your aspirations to make a difference.
You know, I think it's a job that you get up in the morning and you know
Yeah.
you're going to make a difference that day, and not every job's like that. And
Yeah.
I think in health we're very lucky to have that sort of flavour in our jobs, and to work with people who, general practice in particular, they're people. You know, they're very focused. Many of them in general practice, they get to, you know, make long-term friendships and relationships, and I think getting to work with people who care to that level is pretty cool.
And you also said there was lots of there's always new opportunity and things that you're wanting to do and add to the organisation.
Indeed, yeah. I think because we've grown in a growing relationship with our general practice partners, plus also with our DHB, and increasingly the sub-regional groups as well, more projects will come this way.
Right.
And I think, you know, with the direction to move more services into primary care, or, you know, refocus some of those into primary care, we've got lots of opportunity, along with our DHB partners, to do so.
That's a great opportunity for someone. It's not a business as usual job.
Oh, most definitely not.
No.
It's not for the sort of the sort of people who just want to come and do a job. This is actually someone who wants to come and do a passion.
A bit of
Also
passion.
to live in a great area and to give a bit to their workplace and to their people.
Lovely. Thank you, Paul. Is there anything else you'd love to add?
No, I think, hey, come and have a look at the Hutt Valley, look at the opportunity.
Yeah.
We'd love to talk to you.
Lovely. And if you would like to know more about this position, please contact the Johnson Group, details below. Thank you, and thank you today, Paul.
Thanks.
Pleasure to be here.
It's great to be here. Thank you.